Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. On today's show, I'm going to talk about actor Matthew Perry's long and challenging journey with addiction. In his recent memoir, Friends, Lovers, and the Big Terrible Thing, the star of the hit television show Friends talks about his weight changes, the medical emergency that nearly killed him, and the treatment approaches that worked and didn't work. As an addiction medicine doctor, I've cared for patients who've had similar experiences as Perry. So, today I'll share 4 key takeaways from Matthew Perry's addiction story. Let's get started. The first key takeaway is that Perry recognizes that addiction is a disease that can affect anybody.
Your disease is just outside, just doing one-arm push-ups, just waiting for you, waiting to get you alone. Because alone, you lose to the disease. And now I finally feel okay and feel like I've got some strength.
Perry goes on to say, it doesn't matter if you're successful or not. The disease doesn't care. He's right. Multiple national health agencies, including the National Institute of Drug Abuse, or NIDA, and the American Society of Addiction Medicine, or ASAM, have described substance use disorders as a relapsing and remitting disease of the brain that impairs a person's ability to control their or adjust their drug use, despite harm to the person using or to the people around them. Addiction is not a sign of moral weakness or failure. The second key takeaway is that multiple medical complications can be associated with substance use disorders. The most common side effects of opioids are nausea, sedation, and constipation. Perry, however, described the bursting of his colon.
Survived 14 surgeries after a nearly fatal emergency 4 years ago.
They ran me into the emergency trauma room, and it was in there that my colon exploded. Well, I was put on an ECMO machine. And an ECMO machine, when you talk to any doctor, is a Hail Mary. It is the last thing that you do before people die. And there were 5 people that night that were put on ECMO machine, and I was the only one who survived.
He was in a coma for 14 days. As he heals from all he's been through, there's still wear and tear on his voice and speech, and the scars on his body like a warrior back from battle.
I was in that hospital for 5 months and, escaped death really narrowly.
So, does everyone who uses opioids rupture their bowels? No. Intestinal perforation is a very rare medical or surgical complication of opioid addiction. And in fact, there have only been a handful of reported cases. So, how do the intestines rupture from opioid use? Opioid receptors are located not only in the brain, but also throughout the gastrointestinal or GI tract. A common side effect of opioids, as I mentioned before, is constipation. Opioid-induced constipation can be treated with laxatives such as lactulose, Metamucil, Colace, and Senokot. Targeted prescription medications or therapies are also available. However, prolonged and untreated opioid-induced constipation can cause serious harms, as it did with Perry, who reported using up to 55 Vicodin pills per day. Opioids reduce GI motility and the bowels stopped contracting. Pressure builds up within the gut, and if it's not relieved, the bowels can perforate, i.e. they can rupture. This is a medical emergency. If not treated immediately with surgery, the patient is at high risk for death. Sometimes a part of the intestine needs to be removed. A colostomy may be required where one end of the intestine is brought out through an opening or a stoma through the abdominal wall, requiring the placement of a colostomy bag, which Perry needed for a time. But please rest assured that, as I mentioned before, bowel perforation or rupture from opioids is very rare. The third key takeaway is that treatment for addiction is available. In fact, did you know that most people with addiction, once connected to the appropriate treatment and recovery services, get better? And are all treatments equally effective? What works and what doesn't? Perry said he, quote, detoxed over 65 times. His Vicodin habit kicked in badly by age 26. In this clip, Diane Sawyer lists the different approaches that Perry used to treat his addiction to various substances.
6,000 AA meetings, therapy 30 years, 15 rehabs, maybe at least. Half of your life in treatment or in sober living houses? He has been in detox, he estimates, 65 times.
So is detox effective in helping people with opioid addiction? No. In fact, studies are very clear that detoxification alone is associated with over 90% relapse rate. Detox is not treatment. Data shows that people who have the best outcomes for long-term recovery use a combination of medications like buprenorphine, i.e. Suboxone, and counseling or behavioral therapies. Perry stated that he used Suboxone. Unfortunately, he perpetuated a common myth by saying it's the hardest drug to get off. Addiction is a chronic disease, and treatment like medications and counseling should be used as long as the person gets clinical benefit, i.e. they're getting better. They're going to work or going to school, meeting family, maintaining personal connections, decreased or no cravings, etc. In fact, did you know that buprenorphine has been associated with decreased cravings, less dependence on opioids, fewer uncomfortable withdrawal symptoms, and perhaps most importantly, decreased overdose deaths? Just like a person with the chronic disease of diabetes shouldn't get off of their insulin, a person with opioid addiction shouldn't just get off buprenorphine, or i.e. Suboxone, unless or until they just don't need it anymore. And that should be a joint decision between the patient and their doctor or provider. The fourth key takeaway is that people with addiction are highly stigmatized. Did you know that among the 21 million plus Americans with a substance use disorder, only 10% access treatment? Stigma is a major barrier to accessing treatment and care. Just the very fact that Perry is openly talking about his journey with addiction, he is reducing the shame and guilt and stigma that he and so many others with addiction feel.
And now it seems impossible that all those years ago when we were laughing, we never knew that the young star was fighting for his life in a riptide of addiction. It was pulling him to hell and back over and over again, and he was trying to keep it a secret from everyone.
Secrets kill you. Secrets kill people like me.
Now, Matthew Perry has put those secrets on the pages of a book. It is dedicated to other sufferers who, like him, might need help.
It was important to me to do something that would help people.
By sharing his deeply personal journey, Matthew is saving lives. On behalf of my patients, I will be forever grateful to Matthew Perry for being so honest and forthcoming. So, how can you get involved? Learn more about addiction by donating to or volunteering with trusted sources like ASAN, AAAP, SAMHSA, NIDA, Partnership to End Addiction, and many others. Well, that's all for today. Here's your joke of the day. What did the paper say to the pencil? Right on. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.